Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Muslim faithful in Ogun State desert praying ground in compliance with a ban on religious gatherings above 20 persons put in place by the state government. Ahead of school resumption for students in exit classes, the Enugu State government commences decontamination of secondary schools across 17 local government areas. And UK Prime Minister halts plans to ease restrictions in England due to start on Saturday. Welcome everyone. And while the world celebrates, the COVID-19 global numbers continue to rise. According to the World Health Organization, it stands at over 17.3 million cases. The message remains learning to live with the virus and taking the steps necessary to live our lives while protecting ourselves and others, especially those with the highest risk of COVID-19. The Nigeria Center for Disease Control, NCDC, reported that 266 cases were discharged in the last 24 hours in 9 states and the Federal Capital Territory. Delta recorded 102, Oyo 49, Kaduna 35, the FCT 34, Edo 14. 13 people recovered from rivers, 8 in Borno, 7 in Ogun State, 2 each in Osun and Lagos State, while 5 deaths were recorded in the last 24 hours in 4 states, that is Edo, Delta, Ondo, and Osun State. The center reported 481 new confirmed cases, putting the total confirmed cases in the country at 42,689. Total recoveries stand at 19,270, and sadly we've lost 878 people. A proportion of the confirmed cases over the total remains there. Nigeria is 5.69%, and the transmission pattern in the country remains community spread. Now we start in the southwest as the world celebrates Eid al-Kabir in the age of social distancing due to the COVID-19 pandemic. Muslim faithful in Ogun State shunned prayer grounds in absolute compliance to the directives of the state governor, Mr. Dapo Abiodun, who had earlier appealed to citizens to observe their obligatory prayers at home. The popular central praying ground in Lantoro in Abeokuta, the state capital, was deserted. The chief imam of Egba land asked the faithful to be responsible and observe all safety protocols as prescribed by the state government.
Already, the lockdown is there. You understand? In this stage, nobody is going to make any prayer in Eid al-Kabir. You understand? Everybody will be at his own house. To go to the Eid and pray there is only nafila. It's not by force. Even if it is by force, if there's any problem, sit down at your house. By 10 a.m., kill your ram and do it as Islam recommends. It's not by force to go to the Eid.
Social distancing.
You have to follow the government recommendation. It's for our own sake, not for the government's sake. The recommendation of the government is to save our life. If you refuse to do it, you are risking your life.
Well, it was slightly different in a number of states, southeast Nigeria, as Muslim faithfuls gathered at the prayer ground in Awka to mark the Salah celebrations. The faithful thronged the entrance to the mosque in absence to the physical distancing, but when inside, though, the mosque appeared to be filled to capacity. Most of them were wearing the face masks. At the end of the prayers, a large crowd, we heard, surged where the Salah ram was being killed. The Muslim community in Anambra praying for the state, the country, and the coronavirus pandemic to come to an end. More on Eid celebrations under a pandemic in, of course, this is in Katsina State. Adherence to the COVID-19 protocols was mildly followed at some of the prayer grounds, particularly where Governor Aminu Masari observed his prayers. Our correspondent also reports observed that though the Muslim faithful were compelled to use hand sanitizers before entry into the prayer ground, compliance with social distancing was minimal during prayers.
صراط الذين أنعمت عليهم الله أكبر.
Now, away from the celebrations, ahead of school resumption in Nigeria, this is in Enugu State, the government has commenced the decontamination of 297 secondary schools across 17 local government areas in the state. Speaking during the exercise, the Commissioner for Education said the exercise, which commenced today, is expected to be concluded by Monday evening. He also noted that the state government has not only set up a team to monitor compliance with the NCDC protocols across schools when school resumes, but has since begun expansion of school blocks, facilities in order to observe the physical distancing protocol.
For over 3-4 months now, the state government has been involved in renovation and expansion of our school facilities to ensure that we have enough space for our children when they come back. For us to maintain social distancing, it is important that we have enough space, and this is what His Excellency has planned and worked. In fact, a few days ago, His Excellency himself moved around school to inspect our state of readiness. And this fumigation is going to be the last stage, because once we fumigate, our school will be completely ready for students to come back and be safe in the school.
A medical lab scientist from the University of Abuja Teaching Hospital, Steve Oricha, joins us right now from our Abuja studios. We'd like to thank you for joining us on the program.
Thank you, Millicent, for having me.
All right. You've been involved in the pandemic response, but first I want to get your opinion on the Salah celebrations and what we were seeing, looking at the reports before now, crowds and the absence of physical distancing. It appears that compliance is still an issue. Is there any other better way to enforce them?
For me, I truly think there is no better way. And until Nigerians begin to take responsibility for themselves, we'll keep having this problem of having to beg. I'm surprised at seeing even state governors just disobeying the laid down simple rules of social distancing. It is not encouraging at all. Where we see some Eid prayer grounds being empty, we saw some just now from the news card, just crowded, and it's truly is saddening for me. And we can't continue this way, because if we do, we have a long way to go. Millicent.
Do you think that it's a case of people not understanding the gravity of what COVID-19 is?
Do I really say they don't understand, or people just decided to pay blind eyes, you know, or feign deaf to some of these things? Nigerians are seeing. We're watching on the television, even though, yes, we're not seeing visuals of those in our isolation, but I don't believe anybody in Nigeria today will tell you that COVID-19 is not real. I truly don't think so. I want to believe every Nigerian believes that COVID-19 is real. So it is not about not Nigerians not knowing. I want to believe they know. Yes, what do we do? Maybe keep thinking it and keep our advocacy high, letting people know that this thing is real and it's not the respecter of anybody.
So let's talk a bit about testing. We understand that you are also handling the Gene Experts machine, which is one of the machines used for testing for COVID-19. Please explain the process and how it works.
Okay, I'll just tell you the basics. The processes are not what we'll sit down here to talk about. But it's been very good, and for me, it is quite exciting that the government of the day is really looking at that direction. If you notice, which I commend the NCDC for, really, at the onset of COVID-19, we had 5 laboratories, public laboratories, testing for COVID-19, and today we have about 33. And Federal Ministry of Health and NCDC introducing the COVID-19 method, introducing the gene expert method for testing for COVID-19 is quite commendable. For me, it is looking inward. It is easy, it is faster, and it is less expensive. And by the way, as I said, if we can only look inward, well, we test more people. Right now in Nigeria, we're testing 1 to 8,000, which is saddening for me. Ghana here is testing 1 to 80. Rwanda is testing 1 to 50. What is the magic? We can do it here. How? Right now, as I speak to you, the gene expert model that we're using right now in Google that are approved for us by the NCDC and the Federal Ministry of Health, we have over 400 of it in the country. So what we need to do is for the federal government to build up capacity for these gene expert machines that we have in the country, buy the cartridges, and start testing, because the more we test, the more we're able to isolate, the more we're able to treat the people, and, you know, we'll bring this pandemic to a halt in no distant time. But if we want to concentrate on building mega labs of PCR labs that will take millions of naira to complete and to equip and all of that, we'll be wasting our time. The gene expert model is there, as I said. It is very easy. 2 hours max is a working system. Take your test done, and you get your results. So for me, I want to appeal to the federal government that we need to do more. We have these gene experts in the country. All we might need to do for some of them, train the people, buy the biosafety cabinet that is needed for some of these laboratories, and before you know it, we'll bring this thing to a halt.
So that's the thing. I guess perhaps it is time that is of essence right now, and perhaps also that the federal government needs time to buy all the things that are necessary, because they have talked about scaling up testing and with the use of also the gene expert machines that exist across the country. But the thing is, how much time do we have? Do you think that the process takes quite a long time, and this is to scale up capacity across the states?
I truly don't think it should take us time. We have the manpower. We have medical laboratory scientists scattered all over the country. For me, all we need to do, as I said earlier on, keep the ball rolling. The gene expert machines are there. You are not buying a new one. All you need to procure are the kits. And the kits are not very expensive. Buy the kits is government to government, so that the issue of shipping, the issue of having to come and stay at the port and all of that is reduced. You know? So all we need to do is buy these kits, ship them into the country, and activate some of these sites that have already gene experts, which we're using already in country for the detection of tuberculosis, of TB. The machines are already there. As I said, I don't believe in building mega molecular biology laboratories.
All right, we appreciate your time. Thank you so much, Steve Oricha, a medical lab scientist from the University of Abuja Teaching Hospital. Thank you for joining us on the program.
Thank you for having me around.
We have more on the COVID-19 updates when we return. Please stay with us.
COVID-19 pandemic has affected the mood of Eid al-Kabir celebration this year in Bauchi. There's a prevailing quiet in the atmosphere. People are just moving about their normal businesses as if it's not Salah. This is largely due to the earlier ban imposed on Salah festivities. In some of the mosques, people adhered to safety protocols, while in others, it was different.
There's nothing like social distance, I can say. I can say we Nigerian or we African or we Northern, I don't think people are much worried about the social distance, because like this mask and the social distance, most of people I don't care about it. They're just doing what they decide to do just off head, without know how to protect themselves, or all this I can say.
Yeah, some other places, maybe if you look at some other mosques, so there is no any social distance, but they are using masks when you are starting prayers.
This time last year, some pilgrims from Nigeria were performing the Hajj pilgrimage, but this year the story is entirely different. This is due to the ban imposed on overseas pilgrimage by the Saudi authorities.
I think it's not something that we should really bother about, because this thing has been started for a very long time, and it's new with everybody. Even the Hajj attendants were told about the COVID, and we knew about the limited numbers that they should attend the Hajj this year. So I don't think there is any problem, because those that were likely to be there, they were only likely to be there. And I think at the same time, we have no any reason to say no, whatever, because we really have to comply with the COVID-19. So I think those that were likely to attend Hajj this year, so we only expect them to pray for us, that's all, and then maybe by next year, it will be somehow different from this year.
Many residents hope that the coronavirus will go away soon so that they can return to their normal lives. From Bauchi, Hajira Aliyu for COVID-19 updates.
More on flattening the COVID-19 curve, Dr. Zainab Adamo, a senior consultant in internal medicine, emergency medicine in Germany, joins us on the current COVID-19 trends. Thank you so much for joining us, and happy Eid al-Kabir.
Thank you for having me again. Eid Kabir to everyone celebrating.
All right. I want to begin with, as a health practitioner, I mean, how are you adjusting to the new normal, especially in Germany, where you are?
Well, I mean, things are getting back to normal. But sadly, as we all know, the cases have actually rapidly increased since the lockdown has been eased, and we're actually seeing approximately about 635 cases daily, and that's quite a number in comparison to 150 cases during the lockdown period. And also that's about 17,000 cases in Europe and over 250,000 cases in the world. So it's another thing to be underestimated.
So would you say that Germany is now looking towards testing, tracing, isolating, and then treating those procedures?
Yes, well, actually, Germany has done a lot. There are a lot of tests going on, and tests can be done in many places, in the hospital, in train stations, in airport, and actually even some public places. So these things are actually quite new, and I think these are things that should also be implemented in Nigeria.
Okay, but just before we come to Nigeria, I wanted to talk about if Germany is working to finding a cure with the vaccine race all around the world.
Yeah. Well, it is. It has actually, Germany is supporting currently about 3 pharmaceutical companies, and it has supported these companies with over 750 million euro, just to actually try and work and actually get a cure for the virus. And of course, it's supported the World Health Organization with over 75 million euros, and also other humanitarian organizations.
All right, then let's come to Nigeria. Your take on, we're of course seeing a daily rise in cases, and I know you're following that. How best do you think are we at containing the ongoing community transmission?
Well, I think we could do much more than what we're currently doing. And that should include testing. That's very important. We have to test much more than we are currently. Countries are testing almost 60,000 cases daily, and we're just testing, well, in the thousands. So we should actually increase the tests we're doing, and tests should actually be for free, or if possible, for a minimum amount of pay, and it should be an amount that a lot of people could afford. I think that's also important, because not everyone can afford the current price for testing in Nigeria. And tests should be done in public places, in commercial places, and also in offices. I think it's something that is important, that we have tests available to every person. And that way everyone can get tested, and actually by doing that, we will limit the infectious rate.
So
and
now,
actually...
Okay, I was going to ask just finally, and this is about compliance. I mean, there is testing on the one hand, but then there is also the non-pharmaceutical measures to keeping the virus at bay. What are you noticing? And this appears to be the same all over the world.
Yes, it actually is. I think what one can do actually is also, I mean, I just found out today about the 3Ds. And I was wondering, what are the 3Ds? It's actually discipline, distancing, and also detergent. That's something that we should also do, and actually wear masks also. So it's quite important. And I think we as a population are not that disciplined. Now hearing actually previously about Eid Mubarak, how people eat the Eid celebration, how people were actually really not practicing social distancing. That's a problem.
All right, we appreciate your time, your insight into the issue. Thank you so much, Dr. Zainab Adamu, Senior Consultant, Internal Medicine, Emergency Medicine in Germany. Thank you for joining us.
Thank you for having me. Have a good day.
You too. Now, the further easing of coronavirus restrictions in England due to come in this weekend has been postponed for at least 2 weeks amid concerns over an increase in COVID-19 cases. UK Prime Minister Boris Johnson says progress against COVID-19 continues, with the daily and weekly number of deaths falling, but warns that some European countries are struggling to control it, and the UK must be prepared.
We cannot be complacent, and I won't stand by and allow this virus to threaten to cause more pain and more heartache in our country. So that's why last night the Health Secretary announced new restrictions on household contact in the North West, specifically Greater Manchester and in parts of East Lancashire and West Yorkshire. Our plan to reopen the society and the economy is conditional, that it relies on continued progress against the virus. With those numbers creeping up, our assessment is that we should now squeeze that brake pedal in order to keep the virus under control. On Saturday, the 1st of August, you'll remember, we had hoped to reopen in England a number of the higher risk settings that had remained closed. And today, I'm afraid we're postponing those changes for at least a fortnight. That means until the 15th of August at the earliest, casinos, bowling alleys, skating rinks and the remaining close contact services must remain closed. Indoor performances will not resume. Pilots of larger crowds in sports venues and conference centres will not take place, and wedding receptions of up to 30 people will not be permitted, but ceremonies, of course, can continue to take place in line with COVID-secure guidelines.
Pandemic, you can take a look at our website. It's channelstv.com. It has the latest updates on COVID-19, several other stories as well from the World Health Organization. It says that youths, young people are not invincible, of course, because they can take the virus home to the vulnerable. There's several other stories there as well. channelstv.com. That's the program. Thank you for watching. I'm Millicent Nwaka. Stay safe.